And there's really not a lot of births going on in Iowa anymore. And it's a big reason why they have a shortage of obstetricians. Among reasons, many Iowa maternity wards have closed. So if they're not kept busy, they're not going to stay in these locations. In the last almost 2 decades, 29 Iowa hospitals have closed their maternity wards, 8 of them within the last year, and 7 more are still at risk of closing. Medical professional advocates and lawmakers say it's likely a problem that will get worse before it gets better. It's not going to get better, y'all. You know, look, we all know what judgment feels like. We know what it feels like already, you know, but the people that have been enjoying the best of life here, they are just entering it. But it is going to be far harsher because of all of the things they've done. This is just the beginning. And you see how bad the beginning looks. The status of maternity wards is a tale of 2 different stories based on where you live in the state. In the Des Moines metro area, there is no shortage of places to have your baby, and the options are growing. Methodist West Hospital in West Des Moines is adding on to its existing ward in the coming months, doubling the number of rooms there. It is on pace to deliver 1,000 births this year, a record for the hospital. There are plans to add more space to Lutheran Hospital and Methodist Medical Center downtown. I wouldn't call it pressure, says Dr. Steve Stevenson, COO of Blank Children Hospital. We see those who need us and want to come here, but our job is to be right here for them and have a great experience. Outside of Des Moines metro area, healthcare options are vanishing fast. So you really can't ride your population on one tiny area in the state. You really can't. So if Des Moines, they're having 1,000 babies, but the rest of the state, there's hardly any movement in births. All right, so outside of Des Moines, it's vanishing, and the health options are vanishing fast. The Unity Point Hospital in Marshalltown closed its maternity ward in September. In a statement, Sean Hilton, a spokesperson for the hospital, says over the last 6 years, there has been a 45% decrease in the number of births at Unity Point Health, Marshalltown. And in March, the hospital recorded the lowest birth number of deliveries, 18. Wow. In the entire month of March, they only had 18 births. Ooh, in its history. It's clear OBGYN patients are already selecting Ames and Des Moines for their care. This isn't just happening in Marshalltown. In Iowa, there are 118 hospitals, with about half of them with delivering babies. Out of the state 99 counties, 66 of them are without a practicing OBGYN. Wow, that's the majority. Iowa is dead last, 50th out of our 50 states for obstetrician per population. That's our fundamental problem. That's why most of these places are closing, Stevenson explains. He says finding and keeping qualified physicians in rural Iowa can be tough. It's expensive to train them, and the job has a high burnout rate. in rural areas. If you are providing, okay, so ladies and gentlemen, they're going through a lot of what other rural areas are going through across this country that have closed their maternity wards. What they, the problem with rural America, they want these hospitals, but they underpay the staff. And that's a huge problem. And not to mention, it's hard to keep hospitals in rural areas because the population is old. You don't have a booming young population in rural America, not anymore. So there's no need to have a maternity ward. Even if it's Iowa, it's if you got these small hospitals and you got an aging population, it wouldn't even make sense to have a maternity ward. And there's so few young people there having babies, it's really not cost effective for them to even have that. One of the things we are seeing here locally is mothers just showing up at the hospital in labor that we've never seen before, he says. So these women aren't even getting the proper care during their pregnancies. This is Iowa, y'all. This is Iowa. So these women are literally going through their entire pregnancies with no health care, and they're just showing up at the hospital when they're in labor. Wow. Lawmakers said women's lives are on the line. Democratic Senator Janet Peterson says it's not just a staffing issue, but a money problem too. Right now, when a hospital closes its labor and delivery doors, they are being financially rewarded because Medicaid, privatized, doesn't cover the cost of delivering a baby in our state. For every baby born and the mother is on Medicaid, the hospital is losing money to deliver the baby, said Peterson. Wow. That's the first time I've ever heard that. And there's a lot of them on Medicaid, y'all. A lot of them. As of last year, Peterson said just under half of all births in Polk County were under Medicaid coverage. She says since the switch to privatize Medicaid, it put pregnant women in jeopardy, doubling the maternal deaths in the state. Last legislative session, Peterson tried to bring attention to the issue, but Republicans shut down the democratic process in a multi-million-dollar Medicaid budget. She plans to try again next session. So the Republicans obviously don't care that these things are happening in Iowa. I don't think there is any denying it. More dollars need to go to rural hospitals to make sure they are not closing their doors and pushing their patients onto other hospitals that are ill-equipped, said Peterson. The Iowa Hospital Association says the issue isn't just a legislative fix, but a community issue. Wow. These are the areas where poor whites live. And we know Iowa has an extremely low black population, so I don't think they're talking about any of them. The whole community needs to work to keep these rural communities vibrant so people want to live there and raise their families there, said Jennifer Nutt, Senior Director of Nursing and Clinical Services at the Iowa Hospital Association. The association is calling on Congress to help fund rural hospitals, but until then, it says 11 more Iowa hospital delivery, less than 100 babies a year, are on the brink of closing. Wow. So they got 11 more hospitals that will lose their maternity ward because they are delivering under 100 babies a year. Woo! Wow. It suggests women who are considering having a baby and who don't live near a hospital that delivers babies make sure they have a plan before getting pregnant. There really needs to be an open conversation with whoever their OBGYN is to make sure that she knows what the plan is and if she will see her local OBGYN until how many weeks pregnant, she says. Doctors aren't wasting any time trying to solve the issue. Well, how can they really solve the issue if they're closing the doors of the hospital? The director of maternal and fetal medicine at the University of Iowa Hospital and Clinics has received a $10 million grant. The money will be used over a 5-year period to help research and build a system of care to better bridge access uh, prenatal services between rural and urban areas. Wow. So that just goes to show you how bad it is in this state of Iowa. But they won't be alone. It's going to be more states probably already in this situation when you really think about it, with the low birth rate going on in America. But this certainly sheds light on how bad it really truly is. This is bad. You only got one location in all of Iowa, Des Moines, that had 1,000 babies in 1 year, and all of the other locations had under 100 babies. And at one location, 18 babies. That's it for the whole month. This is bad, y'all. This is far worse than anything they are telling us. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.